I noticed that you have a different Botox technique. And could you just walk us through, what are you doing when you're injecting the patient? And what is the age of the patient? She's 53?
Yes.
A wonderful patient of us. So what's the difference between the usual Botox that people are doing here, in this country, and in general in Europe? People start to separate the treatments in different areas. So in order to lower the cost of the initial treatment, they try to make different regions. That's for me unacceptable, because usually what is really important, we don't need to address, let's say, the crow's feet or the 11 lines, for example, or the forehead wrinkles, or any other problem that hypertrophic muscle activity, mimic activity, is make to the face, but to create a balance. And the balance is not a static issue. We have to address the expression. So we need to have expressions in a uniform mode, in the whole face, so the person doesn't look all the time surprised or without any feeling. So you need to make a very normal result. And we Botox the whole face, all areas, sometimes just to diminish if somebody wants a very, very natural results. The quantities of the units of the Botox we are using are smaller, much smaller. We cannot guarantee that the duration is going to be similar or the same as a normal Botox treatment, but the result is much more normal, and people prefer, our clients prefer to have a natural look.
So just to summarize it, you believe that it doesn't make sense to break it in 3 parts, like 3 areas, the Botox. Instead, you believe that it's better to treat the whole face and inject in multiple areas.
Okay, that's the first thing. The second one, whenever you have the toxin, the Botox toxin, has some effects in the body. The body works on that. So in the moment that we have the disruption of the acetylcholine signaling from the neuron to the muscle, the body reacts in a specific way. So if we do more often the Botox treatment, sometimes we have the possibility that the body will develop antibodies. And that means that the botulinum is not going to be any more functional. And that's a big loss.
Does it apply on all the brands if you start using?
It doesn't matter. In reality, the problem is how our own body responds to the consequent treatments. That's why I believe that it's better to have 2, maximum 3 times per year if it's necessary, but not more, because there are many, many people that they would like to have, they're coming every month. And that's really, really not the proper way to do Botox. No matter how profitable for some colleagues it is and convenient for some of our patients, we have to think also like doctors and not only like money-making and beauty producers.
Right. That's your whole approach for the business anyway.
Yeah. And we can say that's a holistic approach for the whole thing. We are looking for all the benefits that we can use by combining treatments together. And
for the patient age, the gender.
Yes, and we always planning in advance. So that means that whenever we are starting with a new patient that's coming to us for the first time, I already have in my mind what steps we're going to follow. And we have a very, very long discussion in our first consultation where we are checking, first of all, it's not bad to say that, but we make the financial scaling, for example, and then how engaged the patient wants to be. So that's a very important thing. And then we can adapt continuously different things in order to give the best possible results. We are not talking about Botox for the expression of the wrinkles. We are not talking only about fillers or any other products like volumizers product. We are not talking only about definitions, jaw lines, all the strengths that are existing in the market, we are capable of doing whatever people need, but I don't wish to change the faces in such a way that they are losing their unique character. So my point is the individualism protection. So in order to have naturally aged people without having problems, issues for too much products of too often interventions, and then also sometimes we're taking the role of a policeman. We're trying to somehow stop them for over-exaggerating whatever they need.
And the next video, you will show us like how to inject.
Yeah, with that.
Okay.